Hi, and good morning. I'm Stephanie Simone. Eric Parker has the morning off. We begin this morning with the first person to hold the title of State Mental Health Advocate in Connecticut. Howard Sovronsky was appointed by Governor Ned Lamont to this position last month. He joins us now in the studio to talk about this. Howard, thank you so much for being here. We really appreciate it.
Thank you for inviting me.
Yeah, so what did you think when you got that call from the governor about this?
I was excited. I was excited that the governor and the legislature have come together to recognize the unique needs of our behavioral health community and the families and individuals who continue to seek help from the very robust system that we have here in Connecticut.
And talk about what this position is and how it can help people in the state.
Sure. It's going to help two ways. Let me just say that the intention of the position and the creation of the office was to address access. Access is really the critical issue facing us as our behavioral health community. So we're doing it in basically two ways. One, we're going to be providing advocacy and help and assist individuals and families who are having difficulty navigating the system of care. While it's very robust in the state, it's still very difficult to navigate and figure out, how do I get the best treatment for the condition I have at the best time close to home? And the second piece is to work with our providers, who sometimes have difficulty with our insurance companies. As a result, they withdraw from being part of networks and limit then the ability of members, of those who are insured, to access care when they need it.
And I really wanted to dive deeper here and talk about why this is needed right now, especially for young people. Do you feel like social media has played a role with any of this? There
are a variety of issues. You know, before I took on this position, I was the Chief Behavioral Health Officer at Connecticut Children's for 5 years. So for the last 5 years, I've been really doing a deep dive into children's behavioral health. The pandemic certainly heightened our awareness of the need for behavioral health, but it was not the beginning of this crisis. There's been a growing demand for behavioral health. Part of it is social media. Part of it is economic stress that's put on families. You have to remember, kids are like sponges, and they absorb all of the different stresses in their environment, whether it be, food insecurity, housing issues, or just the general anxiety that sometimes exists in homes. So we've seen a continued increase in demand for children, as well as adults, as well as our aging population. So there's been a constant growth of demand as we become more aware of the interplay between our emotional state and our environment.
Yeah, it really hits all walks of life, too.
Absolutely, absolutely.
I know, like you said, you spent time at Connecticut Children's. What did you see at the hospital? What did you see coming into the emergency rooms?
We saw kids who previously probably would never have come into the emergency room. Kids who were experiencing anxiety, depression, an increase in suicidal thoughts, increase in suicidal acts and self-harm. We saw an increase in eating disorders amongst young children. It was a very, very disturbing experience walking through the ED. But I know that we had staff there, and we were really committed to making sure that the kids got the treatment that they need. The problem is that our system is so backed up. There is such a demand for care that kids wind up staying in our emergency rooms much longer than they need to, waiting for a hospital bed that is often not available, because the kids in the hospital are not able to find community services upon discharge. So it's a bottleneck that's going on in our community.
And was it primarily teenagers or even younger?
Even younger. When I started in the field, we were told that, suicidal thoughts usually begin at age 10 or 11. We were seeing children as young as 6 who were coming in expressing thoughts of wanting to hurt themselves or wanting to end their life. So it was a very, very profound impact on all of us to see the kids who were struggling. And these are kids who are struggling in silence. They're often not able to articulate and express what it is that they're feeling. They often don't feel comfortable going to their parents. And they wind up sitting and brewing until it becomes a crisis requiring intervention at an emergency room. The good news is that we've just opened up 3 urgent care centers for children in the state, and which provides a real alternative to emergency rooms, where families can bring their children who are in crisis. They can be seen by a psychiatrist, social workers, de-escalate, stay there up until, 23 hours until they feel better and safe enough to go back home.
Yeah, that is good news. I mean, it's sad that it is needed, but it
Right.
is good that those services are now provided. I know that you were a trained clinical social worker. Just if someone's hearing about this for the first time, or they think maybe their child needs help, or maybe their loved one who's older, what are the warning signs? I mean, what are we talking about? What are the red flags in the beginning?
Well, we're talking about people who withdraw, people who suddenly have a dramatic change in the way they've been acting and behaving, perhaps in some older children and adults, an increased use in substance use, right? So we have to look at any real changes in the way a person has been behaving, acting, and frankly, the best thing is to listen. And to listen and to ask, and don't be afraid to ask if your child is feeling depressed and sad and thinking about hurting themselves. Contrary to public opinion, it's not going to encourage a child to do anything rash. It's likely to de-escalate and allow the child to really express what's really going on with them, and allow the parent or the caregiver to help that child get the care that they need.
Yeah, I know with our children, whenever I'm talking to them about anything at school, even if it was just a minor little inconvenience, I always say, thank you so much for telling me. And remember, you can always come and talk to me about anything. And I take it that's something that you advise parents. Yeah.
And it's really important now because more and more kids and teenagers and adults are spending most of their time online. And sometimes even communicating with AI bots. So whatever we can do to encourage people to continue to relate to one another and have those personal interactions and continue to feel comfortable talking to one another, I think is a real plus.
Yeah, AI bots. I feel like that's a whole different segment, but also something we need to explore and talk about, because that is something that more and more people are dealing with and using. Yeah.
Probably another 3 hours on TV for that.
Right? I know. We're going to have to do a special on that, Howard.
There you go.
If people feel like they need your services, they need your help, how can they get in touch with your office?
Yeah, I think we're going to put up our email address.
Yes.
You can reach out to me at that address. Right now I'm building, this is a brand new department. It was established by the legislature and the governor. I'm just 4 months into this. We're still looking to hire staff, but I'm happy to respond to any of the requests that come through, either a individual or family member or a provider who's having trouble with their insurance companies. Please reach out to us and we'll be able to help.
All right, thank you so much. We ran out of time, but Howard, we appreciate your time. Once again, Howard Sovronsky, the Connecticut Behavioral Health Advocate, and we'll be right back.